From KTIV, Siouxland's news channel, this is News 4 Live at 5.
And so that suggests that the virus is out there in the community, and that means pretty much that everybody's at risk. We don't know who might be carrying it. We don't know who we could get it from.
Medical experts confirm what may be the first case of community transmission in the United States. They say a patient from Solano County, California, is being treated at UC Davis Medical Center in Sacramento. Good evening, everyone. Thank you for joining us. I'm Stella Daskalakis. Matt will join us in just a moment. We begin with the first community transmission of coronavirus in the U.S. What is raising some concern in this case is the patient had no known exposure to the virus. In spite of the case of so-called community spread, California health experts say the health risk from coronavirus to the general public remains low. No cases have been reported in any of the 3 Siouxland states, and there have been no deaths anywhere in the United States. Vice President Mike Pence is coordinating the country's response to the spread of coronavirus, also known as COVID-19. The CDC warns a widespread epidemic is possible, but the president asserts the risk to the general public is low. The Trump administration is asking lawmakers for $2.5 billion in emergency funds to prepare and rush development of a vaccine. The first human trial for a coronavirus treatment is underway in Nebraska. Eventually, 400 patients will be enrolled worldwide, but experts say a widely available vaccine may not be available for another 12 to 18 months. Even though there are no known cases of coronavirus in Siouxland, right now many are still concerned. That's because so little is known about the virus. Health experts at Siouxland Community Health in Sioux City say symptoms of coronavirus present much like other respiratory illnesses, with a cough, congestion, and fever. In severe cases, you could experience difficulty breathing. They say the first step is to get a test done.
If you are exposed to someone who is known to have had the coronavirus, or if you had traveled, to China and came back with a respiratory illness type picture, then at that point we would test you for things that we can test for.
If all that comes back negative, Dr. Kelly Ryder says doctors would then send a patient to the State Department or District Health, where they have the ability to test for coronavirus. She says if you are experiencing those symptoms or are concerned, talk with your physician to find out what the best steps are for you. While coronavirus isn't in Siouxland, a pair of school districts are prepared. Administrators with the Sioux City Community School District say they have worked on an active pandemic plan, which is updated every year. They say if a pandemic was issued, the schools would be under the direction of the Public Health Department. Meanwhile, South Sioux City, Nebraska school administrators say they too have a plan in place for health situations like this one. They say they have been proactive in terms of communication, not only inside their district, but with county and state health leaders. Administrators at Morningside College say right now there are more than 24 students and faculty members studying abroad in Italy and the Netherlands. The school says the 2 students in the Netherlands are at no risk at this time for coronavirus. Meanwhile, the remaining students and faculty in Italy, part of the Semester in Italy program, are aware of the cases of the virus, particularly in the northern part of the country. School leaders say the faculty with students have extensive experience abroad. Faculty are closely monitoring the situation and providing regular updates to the students and Morningside administrators. The school says based on the information as of today, they intend to continue all active study abroad programs. While the U.S. fights to contain the disease, coronavirus has gone global. What began as an outbreak in China has now reached every continent except Antarctica. Hundreds more cases were reported today in South Korea and China. Japan's Prime Minister recommends all schools remain closed through March. In China, the number of new cases day to day seems to have stabilized, but the opposite is true in South Korea. 13 people have died in South Korea, and the number of cases there stands at more than 1,765. Up from more than 1,260 a day earlier. That's a little more than 500 new cases in just 24 hours, underscoring how contagious the virus is as the country tests tens of thousands of people for coronavirus. A patient was dragged back into quarantine after escaping from a hospital today in the Republic of Georgia. After he got out of the hospital, he talked to reporters outside, thanking the doctors who were treating him. Then, as cameras rolled, as you can see here, health workers dragged him back into the hospital. The man later was transported to another town where patients are being quarantined. He has not yet been diagnosed with the virus. So how quickly did the virus spread? The first reported case was December 31st in Wuhan, China. On January 21st, the first confirmed case in the U.S. was identified in Washington state. A man in his 30s developed symptoms after a return trip from Wuhan. On January 30th, the World Health Organization declared a global health emergency. By February 11th, the Chinese death toll reached nearly 1,020. And by February 17th, the death toll in China climbed to 1,770. On Wednesday, the global death toll was nearly 2,800. Today, more countries are reporting their first cases, including Estonia, Denmark, Northern Ireland, Norway, Romania, Greece, Georgia, Pakistan, and Brazil. We've created a page on our website for all your coronavirus coverage. You can check out the latest reports from the CDC and find tips to make sure you stay healthy. All that information and more can be found underneath the News tab at ktiv.com. Although the risk to the general public remains low, the virus continues to cause anxiety on Wall Street. The Dow Jones Industrial Average sank nearly 1,200 points today, deepening a week-long global market rout caused by worries the coronavirus outbreak would wreak havoc on the global economy. The S&P 500 has plunged 12% from the all-time high it set a week ago. The index is headed for its worst week since October 2008.